Imagine feeling isolated, like your life is being taken over by painful and debilitating symptoms. This is what it can be like for people with AHPs, a family of rare genetic diseases characterized by potentially life-threatening attacks. If you've never heard of AHPs, you are not alone. Many patients are often misdiagnosed or remain undiagnosed for up to 15 years. To tell us more about these diseases is specialist Dr. Bruce Wang and Mary, who has been living with this condition for over 20 years. Thank you both for joining us today.
Thank you.
Thank you.
And I've done a certain amount of studying for health-related topics over the years, and I have to say, Doctor, I've never heard of this myself. Tell us about AHPs.
Sure. So the acute hepatic porphyrias are a family of 4 different inherited and rare disorders. They primarily affect women during their reproductive years, and it presents with episodic but severe and potentially life-threatening neurologic attacks. The primary symptoms are severe abdominal pain, but patients can also develop weakness, numbness, and even mental status changes.
That's crazy to think that it all starts in the brain, too. What is causing this?
So what causes the symptoms are abnormal accumulations in the body of a chemical that is a neurotoxin and can damage nerves. And we believe that the nerves in the abdomen are most sensitive to this chemical, which is why abdominal pain is the primary presenting symptom in most patients with acute attacks.
And did you say that this was a family type of inherited kind of disease? And, you know, what's the prevention for this?
That's correct. So the disease is an inherited disorder. So we acquire the mutation by inheriting from our parents. But it's a disorder where the attacks don't occur unless it's triggered by some inciting event. The most common triggers are taking of a new medication that can initiate the attack in patients who are at risk because they have the genetic mutation.
And how many people have this? And I would understand why this could be something that's often misdiagnosed.
That's correct. It's a rare disease. We believe that as many as 1 in 2,000 people may carry the genetic mutation that puts people at risk. But it may be as few as 1 in 20,000 people will ever develop an acute attack during their lifetime. And that's one of the reasons why this disease is oftentimes misdiagnosed or undiagnosed, because it's so rare and most physicians don't think of it, and so we don't test for it. And the second reason is because the symptoms during an acute attack are not specific to the porphyrias. Abdominal pain, nausea, weakness, numbness, those are symptoms that mimic other more common disorders. And so that's the second reason why this disease is oftentimes undiagnosed.
Now, Mary, when did you figure out that you had this issue, and, you know, what's your life like now?
I did not know I had this until I was 28 years old, and like Dr. Wang explained, I took a new medication, a sulfonamide antibiotic, and this woke up the disease in my body. It took about 4 to 5 days on the medication for my symptoms to become severe, and I ended up with severe, debilitating, like crunched over abdominal pain, and I ended up passing out. Presented to the ER and was then hospitalized. Over the next 18 months, I had 12 more attacks, basically same symptoms with the abdominal pain, nausea, vomiting, pain throughout the body. I had several misdiagnoses.
I bet.
And every test you can imagine, MRIs, CAT scans, blood, urine tests, and everything showed I was perfectly healthy because they never thought to do the test specifically for porphyria.
So what do you do
since
now?
That time?
What about treatment now? Do you have options?
Well, the best thing for porphyria is to avoid triggers, but even that does not keep you from having attacks, because a lot of women will have attacks, say monthly, from their progesterone. Their own hormones can trigger their attacks. Really, the only treatment right now is something that you'll take after you're already triggered, and that's what makes it hard.
I bet.
And we're hopeful for, in the future to get some new treatments.
Right, and doctor, you know, if folks are identifying with any of these symptoms listening right now, where can they go for more information and, you know, bring that awareness out there?
Yeah, so people can go to the American Porphyria Foundation's website at porphyriafoundation.com, as well as the company Alnylam, who's actively working on developing new therapies that could be effective in preventing these attacks. And they have information at alnylamact.com.
Thank you both so much for this information, and we'll be right back.